Okay, great. And I'll go ahead and share my screen and we can just go through each of the sections and give our approval or not. I guess it's really up to Meredith at this point. Um,
Yeah, because it's already two yeses from Kenny and I.
yeah, we've been through the proposal already, so
Try to get a little vote from everybody. And then it goes on to a bigger, so the heads of each sector get together um, and go the final approval for those. Everybody kind of votes on. There's like a 7 point, I think,
mhm.
um, criteria, and if you get enough, then you get funded. So this is specifically Darien's, which is very similar to the ones that we did for, or I guess the one that we did for Children's Mercy to start a Just Walk program like 2 or 3 years ago, which has been a
Yeah.
little less successful than we wanted. But I think where Darien plans on doing it and his idea of doing it, I think will probably be pretty successful because there's a captive audience there every
Mhm.
week. So um,
Yeah.
yeah, do you want to go over it, Katie?
Yeah, I wrote it, so it'll
Yeah.
probably be easier. So the first portion is just a brief description of the proposed project, which is just starting a Just Walk program in a collaboration between St. Luke's and Boys and Girls Club. There's a little information on what Just Walk is. So it's a subgroup of Walk with a Dog. So any care professional can actually lead a walking or lead a walk. It doesn't have to be like an actual physician or anybody. You could have somebody who's a dietitian. So it's just kind of describing a bit of the background of what Just Walk is and what it provides to the community. Um, and then it goes through how much we are requesting, which is 700 to just establish the walk. If we need to increase that to a little more to kind of um, take into consideration maybe incentives, we can. Um, but we'll have to do that prior to the core work group meeting. So we can discuss that after this, going through this proposal. Um, the strategies it supports. So it supports more than just our healthcare sector because Boys and Girls Club, it'll be established at a park and they're more along lines of community recreation. So it supports our parks and recreation sector strategy 11, tactic 1, building cross-sector partnerships to promote physical activity in public parks. And then our healthcare sector strategy 19, tactic 1, developing partnerships with community organizations to promote safe and equitable access to opportunities to walk, cycle, swim, play outdoors, and access active transportation to expand opportunities for recreational activities. And then it also supports strategy 20, tactic 3, healthcare professionals to be role models for active lifestyles for patients. That was a lot. And then the system level it addresses is individual, as this is more of just a behavior change opportunity for community members to be more active. Um, and then what other sectors would be involved? So Parks and Rec. However, although we would like their support, we're not asking any money from them. We have plenty in the healthcare sector to cover the cost of starting a Just Walk program. So, um, and then what would the next steps be after completion? It's just hoping to continue offering more walks and perhaps connecting with other healthcare institutions. That's always been our goal at Children's Mercy is helping um, connect other walks and then also increasing the number of institutions that provide walks. So, and the amount we're asking for is $700 to start the actual program. Are there any questions?
So, what will the $700 pay for?
That is a 1 year startup. So it's $700 to start a walk that covers your insurance for one indoor and outdoor location. And then you also get a starter kit. So it's like 5 t-shirts, a water bottle, a watch, some RX pads, and I think that's it. After that year is up, there's a $250 renewal fee every year after, and that's to cover your insurance.
Okay.
So, yeah. Now, keep in mind, like I said, there's a starter kit and there's a leadership portal as well. So with that leadership portal, it provides you ideas for topics to discuss at walks, as well as like free posters, brochures. So it helps with advertising, and you can also connect to the actual Just Walk assistance group, and they can promote your walk too. You'll have your own page on their website that talks about your walk that you can update regularly. So you have a lot of support, and that it pays for that support too. But as I mentioned, you do get like a starter like incentive box of t-shirts. You can hand that out to your healthcare leads. But keep in mind again, it's only 5. So if you wanted to ask for more money, or St. Luke's did, sorry, our boy St. Luke's, if they wanted to ask for more money to purchase more t-shirts, we can account for that and write it into the amount we're asking for. So
Yeah, and typically, the idea behind it is that there'd be like about a 5 to 10 minute informal talk by the healthcare lead who's ever there,
Okay.
on basically any healthcare topic. It doesn't have to be just exercise, but we assume probably most of the time it'd be about exercise or nutrition. Um, but I mean, if you know, if that Boys and Girls Club goes off like gangbusters, I mean, it's once a week or twice a week where they're getting the groups to walk. I mean, no one has to talk every single walk. It could be, just however you set it up. Once a month, there's an actual talk, and the rest of the time it's just get together and walk for 30, 45 minutes,
Yeah.
while the
Yeah.
kids are playing baseball or basketball or whatever. So
No, that's
We
it's
great.
have a
It's with a kind of out of the box toolkit, so he's not having to invent something out of thin air.
right. Yeah, and that's been our biggest struggle, is just being able to get healthcare people there. Um, like I wanted to help, but I just, the schedule just doesn't work out. I'm far away from the actual walk, or they're on Saturday mornings and we're covering football or soccer or whatever, on the weekends with our sports medicine group. So that's just been some of the struggles that we've seen over running it. So I think the less formal and specific it is, the easier it is to keep doing, would be my recommendation.
I do think,
Um,
and I don't know if Darian has talked about this at all, because you mentioned additional funds for incentives. So we had a program, it's kind of on pause right now, that we started with the Boys and Girls Club called Reach In. I don't know if Darian has mentioned that at all. It was a healthy lifestyles program. It was originally supposed to be, so we planned it pre-pandemic, got our initial funding like right as the pandemic was starting. It was initially supposed to be 16 weeks, and then it just kept getting whittled down eventually to 4 weeks. And it was just really, really tough to get people to participate. I mean, we tried we had focus groups before we started the program. We tried to remove any barriers to attendance. And it was just really hard to get engagement of the Boys and Girls Club parental community. Now I do know Darian has a captive audience here with the practices, and hopefully the parents coming and staying for those. But I do think if there is some opportunity to build some incentives, and Darian may be able to say better. I mean, I'm assuming that these parents are coming week after week as their kids are practicing. But if there's, some sort of like punch card or something that you participate in so many walks, then you get that the t-shirt or something. I do think, unfortunately, sometimes it does take incentives to get people to participate.
Yeah. Well,
yeah,
and
we had
go ahead.
Sorry, Jay. I was gonna say we had a similar situation. So we partnered with Chris Harris at Harris Park. And so I don't know if you're familiar with Chris Harris Park. Okay, it's in the Ivanhoe neighborhood, and he established this park himself. So it actually, there's like a basketball court, a walking trail, a playground, and a golf course. I can't remember how many holes it is. I think it's like 7, maybe more. But he did this himself and he offers youth programming. And he partners, I can't remember the golf organization he partners with, but they come out and teach kids how to do play golf. So
First tee?
I think it's first tee. I was like, it's T something.
Yeah,
Thank
I
you.
think it's first
It
tee.
is first tee. And so we had done a Just Walk program there and we were targeting parents, but we didn't have any luck either. So, and we did do incentives. So if they attended a certain number of walks, they got a t-shirt, but we didn't have much success. So definitely understand.
I mean, it for what it's worth, if you got a bunch of St. Luke's swag, it's something you can do with that, like
Yeah.
water bottles or stress balls or I don't know, whatever St. Luke's has
Yeah.
got a bunch of umbrellas. I don't know. We can do stuff like that too.
When
Opportunity for
is
some
he
marketing advertising.
when is he planning to start this?
Again, it's all maybe. So he had discussed interest in it and wanted to get this approved quickly. I followed up with him last week and I guess he was still talking to his leadership team. So we're just trying to assist and make sure we've got everything in place once he gets the go. And if he doesn't get the go, well, that's okay. We don't need to fund it.
Yeah, but if he gets it, then I don't see why this wouldn't get approved by the sector lead group next week or 3
It's
weeks.
next week. It's on the 15th.
Next week. Okay.
Yep.
I'm just gonna remember. So yeah.
Yeah, and I can talk to him too. We share managers, so I just hadn't heard that because he's very involved as well in the Casey, Missouri Prosperity Zones project. So sometimes I feel like sometimes all of this stuff is getting a little intermingled.
Yeah.
He's got a lot cooking.
That's good.
He was actually at the last Kansas City Healthy Lifestyles Collaborative meeting, the quarterly meeting that you had mentioned. He was there was it last week? 2 weeks ago?
Yes.
I should
Yes.
know this. I helped organize it. Weeks just blur together. But yeah.
So I guess officially, I think this project should go forward. So that's my official vote.
I agree. I think it's worth a shot.
Perfect. Well, then we'll take it to the healthcare sector next week or not healthcare sector, my bad, our co-work group next
Yeah.
week. And they'll do one final vote. So it's, as Jay was explaining, it's made up of all of our sector leads. So they'll have the final say. And if they approve, then we write a congratulations letter, we send out a W-9, ask you to fill it out, and then that's really it. So awesome. Okay. Well, Jay, you kind of gave updates already for our Just Walk group. Did you mention anything about how we have one at Adele Hall?
No, yeah, so Children's Mercy has a Hospital Hill walk that they're trying to get basically employees and maybe parents or patients over at UMKC, if they got loved ones or whatever in the hospital, and give them a break during the day. They can come down and walk around the community garden usually, but it sounds like in a month it'll be in the Crown Center, right?
Yeah, so the Health Science District has a park. Oh my goodness, why can't I remember? Hospital Hill Park. And there's a walking trail. I know that 4 loops around it make a mile. So they'll just walk around that walking trail and then sometimes they'll veer off and they'll actually walk around all of the Health Science District because there's a lot of cool locations a lot of people aren't aware of, like the Serenity Garden at the Ronald McDonald House. So sometimes the walks end up being a tour throughout the Health Science District. And like Jay mentioned, we are targeting employees specifically, at least through Children's Mercy, but it's open to anybody in the Health Science District. So if they are patients, are parents of patients, or students over at UMKC, it's open to everyone. The thing with Children's Mercy targeting employees is that I think I heard Shelley right. If they attend 5 walks, it counts for wellness points. So yeah,
Yeah,
kind of
it just our,
an incentive.
I'm sure St. Luke's has a wellness thing too, like through HR and through the kind of insurance. Maybe they don't, but for like Children's Mercy, if you hit enough wellness points, you get extra money put in your FSA or HSA. So that's a way to encourage kind of in the area, which maybe St. Luke's does something like that down at the actual hospital or at the satellite campuses. But that's kind of the idea right now. There's going to be UMKC has a Just Walk that they do out at Swope. And that's been really successful. They've partnered with the AARP for that. I think KU has one, and the business and industry sector of the KCEPA plan, they are thinking about doing a Just Walk out at Corporate Woods. I think was the location they were targeting, just because there's so many offices out there. So opportunities, lots of different places for that. And ideally, if there's many of them going on, we can get like a Just Walk calendar. So if people really like it, they could do it more than once, or if they live closer to one place than the other, they could go there. So those are some of the thoughts about it in general.
And then I know Jay also gave an update about our curriculum group. So he mentioned Dr. Trilk, but we also are helping to plan another grand rounds for next year. Do you remember her name? It's around like food as medicine, and it's actually being hosted by KU, but the grand rounds is I guess it's going to be one at KU and one at Children's Mercy. I know that. I can't remember her name. Do you?
I am looking it up, but I don't. Marissa Love is actually in charter, but she's not. Yeah, but I don't have it on my. Not that I'm finding. Anyway.
Okay,
no,
so Dr.
but we
Jacqueline
do.
Alvin.
Oh, there you go. But yeah, but that's something like KU Grand Rounds, Children's Mercy Grand Rounds. Usually they allow outside people to listen in. So if anybody at St. Luke's is interested in that, something you want to spread around the hospital, that's something to listen to. And we're gonna try, at least for part of it, maybe we'll see how all the AV equipment goes, but trying to maybe make a actual cooking session videotaped and streamed. That's in the works. See if that'll happen.
Yeah. So there's that update. And then UMKC, speaking of implementation projects, one of the associate professors wrote an implementation project to create physical activity courses that were free, that targeted not just like physicians, but also like individuals who were public health majors. So students in different fields related to, at least still within healthcare. And so they just finished that. They tested it with, was it 40 students, I think? But it's now
Sounds right.
open and free. So I think I actually have that on my notes if you want to check it out or pass it along. But it's part of our curriculum group. I don't have it pulled up, but I will find it.
It's a QR code. And I was just looking at it this morning. So you could make flyers, Meredith, if you wanted to, or just send it out via email. You can click on the link. So, but yeah, free and gives you a little education on physical activity, and people kind of choose their level. So there's one for healthcare workers, there's one for like lay people, there's and some in between.
I think that's all of the updates within our healthcare group. I do have some other things I wanted to share. Just some resources. So, and I'll include them in a newsletter. I know I haven't done one in a while, but I wanted to make sure we had stuff for a newsletter. And now we do. So one is the US Report Card on Physical Activity for Children and Youth. One of our associates at Children's Mercy, Jordan Carlson, led this project, and that was just recently released. I don't know if you guys have heard about it or had a chance to check it out. But I'm going to drop a link in the chat.
Okay.
And then I hope I don't sound like a broken record, but Meredith, if you didn't know, we just recently, another implementation project we funded was our State of Play report card. So the Kansas City State of Play report card, we partnered with Aspen Institute and surveyed youth within a 6-county area that Children's Mercy serves, as well as coaches, professional teams, teachers, and we have a report card now just related to sports and physical activity in youth. And Jay, you were a part of that. Do you want to speak more on that while I find this?
Yeah. So Aspen Institute is all about making youth sports more equitable, basically, getting more kids moving through sport. And they took some of the work that the KCPA plan did, just surveying youth and learning about physical activity, and they kind of expounded on that and did more about sports participation and had some really good data and some really good numbers, especially the one I think that I think gives us the biggest chance of getting Children's Mercy really into it, is the fact that youth sports improve self-esteem and improve mental health, and physical activity improves mental health, which we already knew, but it's just more data that says that, and specifically about the Kansas City area. So that's one of the big ones. And then they talked about just the equity of it. So low income and severely low income and middle income and higher income, and just showing the disparity between what kids get to participate in and play in, and trying to help us come up with some different ways to tackle that. And then just the quality of youth sports as well. So we talked about maybe starting a project with some just kind of local regional certification of some of the sports groups in town, so that parents have a better idea of organizations that are really conscious on sports safety and equipment checks, and making sure that the parents and the coaches aren't abusing the refs verbally and things like that. So those are some of the ideas that we're hoping to move forward with on that.
Yep.
That's kind of what the KCPA plan is about. But there's all sorts of different sectors. So obviously over at St. Luke's, I think the healthcare sector is probably the best place for it. Bless you, Katie. But you can, if you know of other people who want to get involved, who might be sort of experts in different areas, I think there's a place for just about anybody who wants to be involved to join the KCPA plan. So spread that through the organization or through friends. We'd love more people, more collaboration.
Absolutely.
Well, I'll just announce our next meeting is Tuesday, November 5th, if we stay on schedule. So there is a link to register for that meeting. Meredith, is there anything you wanted to share that St. Luke's is doing?
Not at this time. I don't think, it seems like you guys are tied into our partnership with the Boys and Girls Club and what Darian is doing there. As I mentioned, I'm doing a lot of work just around social drivers of health and healthy eating. We do have a produce prescription pilot that we've been doing with Canby's Markets. And I think that's getting ready to be replicated at Children's. So you may be familiar with that.
Mhm.
But yeah, other than that, I don't really have much else to report out.
Awesome.
Cool. Well, we will go ahead and let you get back to it. And yeah, if Darian, you end up talking to him and he's got any questions about the what we're going to submit next week to the big group, just tell him to let us know. But otherwise, we're going to go forward and submit that for him and see if we can get some funds.
Awesome.